is the head-to-toe assessment for advanced health assessment. So first, we would just do a general inspection when she walks in. When we converse, I would just kind of look at the way she walked in, how she is speaking, what's going on, and just see if there's anything abnormal that sticks out. I would ask her to go empty her bladder and put on a gown or a robe. Then we would get a set of vitals. We'd get a blood pressure, her heart rate, her respirations, her O2 sat, a temperature, and we would also get a height and weight. And then we would start with the assessment. We'd start with the head and face. So I'm just going to look at her eyes. I'm looking at her ears, her nose, her lips. I'm looking for anything abnormal. Looking at her head. Then I'm going to palpate her scalp. See if there's any tenderness. I'm going to feel her hair for any brittleness. I'm going to look at her hair, see if there's any nits, any scarring, any kind of dandruff, anything like that. So then we're going to palpate her facial bones. See if there's any tenderness, anything I feel it's anything tender. I'm gonna feel her temporomandibular joint. Open your mouth for me. Okay. Look for any crepitus, popping, locking, anything abnormal. Then I'm gonna palpate her sinuses, look at the frontals. Is there any pain with that? And her maxillaries, any pain with that? Okay. Next, we're gonna test her sensation. This is also testing her trigeminal cranial nerve. So if you'll just close your eyes, just tell me when you feel me touch. So she feels all that. So we're going to move on to the eyes. So I'm just looking at her external eyes. I'm looking at her eyebrows, her lids. I'm looking at her lashes, looking at her pupils, her iris, looking for any kind of fasciculations, any redness, discharge, crusting, styes, any inversion, eversion, anything abnormal. So then I'm going to palpate her lacrimal apparatus, see if there's any swelling, and there's not. So I'm going to get my ophthalmoscope and I'm going to check for a red reflex. Just look at me. Okay. She's got a good red reflex in each. You would also look at the optic nerve, the disc, the lens. You would look at the characteristics of the blood vessels and all of that. I'm looking at her periorbital area for any swelling. I'm going to look at her conjunctiva sclera. So I'm going to pull your eyelids down and I want you to look up. Okay, that looks good. Now I'm going to pull them up and I want you to look down. And all of that looks good too. We're not going to do visual acuity tests for time purposes. We're not going to do the Snellen chart, the cover-uncover test, or the near vision. So we're going to move on to the ears. So I'm looking at how her ears are positioned on her head, symmetry. I'm looking at her landmarks on both ears. I'm going to palpate her auricles, any tenderness or anything. Okay. Next, I'm going to do a whisper test. I'm going to say a combination of letters and numbers, and I just need you to repeat them.
7AB5C. 392AF.
All right, so next we're going to do the Rhine test. I'm going to strike my tuning fork, and I want you to tell me if you hear it the same in both ears.
Yes.
Okay. Next, we're going to do the Weber test. So this is going to test her bone conduction hearing versus air conduction hearing. So first, just tell me when you quit hearing this noise. Okay. Tell me when you quit hearing it. So her air conduction was twice as long as her bone conduction. So next we're going to get the otoscope, and I'm going to look into her ear canals and look at her tympanic membranes, looking for anything abnormal. Looking for a pearly gray eardrum, and that looks good. Noting any abnormalities, if there's any red bulging vessels or a busted eardrum or impaction if you can't even see the eardrum. So next we're going to move on to her nose. I'm just looking at her nose. I'm looking at how it's placed on her face, looking for anything abnormal. I'm going to just palpate her bridge of her nose, her cartilage. Is it painful at all? No? Okay. Next I'm going to take the otoscope, and I'm just going to look in your nares. I'm looking at the mucosa. I'm looking at her septum, the turbinates, looking for anything abnormal. Next, we're going to do nair patency. So I would like you to occlude one nair and breathe. Okay, the other side. And that was easy for you? Mm-hmm. Okay. We're going to move on to the mouth. I'm looking at her lips, her external lips, just at their shape, looking for any kind of sores, anything abnormal. Next, open your mouth for me. I'm looking at her tongue. I'm looking at her buccal mucosa. Stick out your tongue, say ah. I'm looking at her uvula. Looking at her anterior posterior pillars, her tonsils. I'm looking at her teeth, looking at the number, the characteristics of her teeth, smelling for any mouth odor, anything abnormal, looking at her soft and hard palates, looking at the floor of her mouth, and all of that looks fine. Next, I'm going to check a gag reflex. So if you open your mouth and say ah, okay. She's got a good gag. If you can just stick your tongue out for me, move it up and down, side to side. Okay. Do you have any problems with tasting anything? Okay. So now we're going to move on to her neck. If you'll take your robe off a little bit. I'm just looking at her neck. I'm looking at her traps, her shoulders. I'm looking and see if there's any pulsation, visible pulsations from her carotids. Looking for any kind of JVD. Looking at her trachea positioning. Looking for a thyroid. Anything like that. So I'm going to come behind her, and I'm just going to palpate her trachea just to see if there's any pulling. Can you swallow for me? When she swallows, I can feel her thyroid, and no nodules or anything like that. We're going to test some range of motion. Can you move your head side to side for me? Up and down. Can you spin it around? Okay. I want you to push against my hand. Okay. Okay. Can you shrug your shoulders for me? Okay. Next, I'm going to palpate her lymph nodes. I'm going to do palpate her preauricle, postauricle. I'm going to go occipital. We're going to do submandibular, submental. We're going to do her superficial cervical chain, her deep cervical, posterior cervical, down to her supraclavicular, infraaxillary or infraclavicular, and her on into her axillary nodes, just to see if anything's swollen. And it's not. Going to feel for a carotid on each side. And all of that feels good. Now I'm actually going to listen to her carotid, see if I hear a brewery or a thrill. Smooth, thyroid. And there's nothing abnormal there. So now if you'll take your robe off so I can look at your arms, we're going to move to your upper extremities. So I'm just looking at her shoulders, I'm looking at her arms, I'm looking at her hands, I'm looking at her skin, nails, just palpating. Is Is anything tender? Is anything hurt? She's got good temperature. She's warm and pink. I'm looking at her fingernails for any kind of clubbing or cyanosis, any abnormalities. Can you move your arm for me up and down? Okay. The other one. Just put them up. No. Nothing. All right. So now we're going to move on, and we're going to just look at her back. If you could just turn to the side for me. So looking at her back, always in every body system assessing her skin. So I'm just going to look at her expansion, go to her crossovertebral ankle, and take a deep breath for me. And my fingers should move symmetrically when she does take a deep breath, and they do. Now I'm going to test for any kind of costovertebral tenderness. So I want you to tell me if you feel any pain with this, okay?
No pain.
Okay. All right. So now I'm going to move to the lung assessment. So first I'm just going to inspect. I'm just counting her respirations. I'm looking at her respiratory effort, looking at her skin, looking for anything abnormal. Next I'm just going to place my hands, and I just want you to take deep breaths. I'm just seeing if her expansion is symmetrical, if I feel any kind of struggle or anything like that. So next we're going to test for tactile fremitus. So I just want you to say 99.
99. 99. 99. 99.
Lift your arms for me.
99. 99.
Okay. And all of that was her, it was the same in all of her lobes. So now I'm going to percuss. I'm going to percuss each one of her lobes as you hear resonance. Put your arm for me. Okay. So now I'm just going to listen. Should you take a deep breath for me? Raise your arms for me. One more. Okay. All of her lung sounds sound good. Now, to test for her diaphragmatic excursion, which is how much her diaphragm moves when she breathes, I'm just going to walk through it. You would go to her left scapular line, and you would percuss down until the sound changed from resonance to dullness, and then you would mark it, and then you would come all the way back up and mark it again when the sound changed from resonance to dullness. It should be 3 to 5 centimeters, and that would be her diaphragmatic excursion. I did it with my last respiratory assessment. So next we're going to move to the anterior chest, heart and lungs. You would do the same thing. You would count her respirations. You would look at her respiratory effort. You would look to see if you saw any pulsations, any heaves, anything like that. We would, again, feel for tactile fremitus, which we just did, and then expansion. I didn't do expansion in the front, so if you'll take a deep breath with me. Okay. And my fingers move symmetrically there too. So I'm just gonna feel. I'm just gonna feel for any kind of pulsations, any thrills, anything. I'm gonna feel her heart, feel the apex, the base, and then her borders. Um, I already percussed her anterior lungs. You could percuss the heart to estimate the size of the heart, but you would really only do that now if a machine like a CT wasn't available. It's not very accurate. So now I'm just going to listen to her heart sounds. So I'm going to start with her aortic. I'm going to move to her pulmonic. And then her apical or Erb's point. And then our tricuspid and mitral. I would also want to feel for her apical pulse, so I'd go mid-clavicular line, and it's going to be the 5th intercostal space. And I do feel that. So next, we're actually going to do the abdominal assessment last, since we have to switch positions. So we're going to go to her legs and feet. So I'm just looking, inspecting, looking for anything, looking for any edema, feeling for temperature, if it's the same, she's warm and pink. Pull against my hands. Okay. Push. Okay. I'm going to feel for a popliteal pulse in each side. And then a post-tip pulse. And then I'm going to feel her pedals. Just put them on my legs for me. Okay. And I didn't feel her brachials or radials when I did her upper arms. So be sure to do that. Okay. So next, we're going to go on to her neuro assessment, and we're going to assess her cranial nerves. So the first one is her olfactory nerve. So I would just like you to close your eyes and tell me what you smell. Coffee. Okay. Then we're going to the second one. Is going to be her optic nerve, which you would test visual acuity with the Snellen chart. Then her oculomotor, we tested that when we did the 6 cardinal fields of gaze. Then it would go on to her trochlear, and we tested her trochlear nerve with the cardinal fields of gaze, and then the light response and accommodation. We did trigeminal, and we tested her sensation on her face. Next would be the 6th nerve, trigeminal, and then abducens. So the 6 nerves of the abducens, and we did that with the cardinal fields of gaze. Then we would move on from the abducens. Facial. So we did the facial with her tongue, sticking it out, moving it side to side, up and down. Can you close your eyes for me? Wrinkle your forehead. Poke your cheeks out. And then stick your tongue out again, move it up and down, side to side. Okay. Then it would be her acoustic nerve, which we tested with the Weber test and the Rhine test. Then it would be the glossopharyngeal nerve, and you would test that with swallowing, and she swallows good. If she has, she can taste on the sides of her tongue, which she did that. And then it would be the vagus nerve. So we did that with the shoulder shrug. Her traps and we tested with that. After that, we would do her, the 12th one is our hypoglossal nerve, and it's moving her tongue around, swallowing. I did not test her cranial. Your vagus nerve was your gag, and then your spinal accessory nerve is your 11th nerve, and we did that with, I got them mixed up earlier. Her spinal accessory was the one where we did the shoulder shrug. I'm going to test your corneal. Okay. She's got a corneal on that side, corneal on that side. So then we're going to go to musculoskeletal, and I'm going to get my reflex hammer, and okay. Okay, now just let your arms hang. Okay. Yeah, just turn for me a little bit. Okay, Achilles. Okay. I'm going to test her pain sensation. Close your eyes for me. Tell me if this is a sharp pain or a dull pain.
Dull. Sharp. Sharp. Dull. 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 Sharp.
Okay. Now we're going to, we already tested her cervical spine when we did your neck assessment. So if you'll stand up and just bend over for me. Going down her spine, any pain, looking for any kyphosis, any lordosis, anything abnormal. Now can you bend side to side for me? Any pain with that?
No.
Okay. So now we're going to go do the abdominal assessment. You'll just lay down. I'm just looking at the contour of her stomach, looking for any pulsations, anything abnormal. Everything looks good. I'm going to listen to her bowel sounds in all 4 quadrants. Okay, and now I'm going to listen to her aortic, and then her renal, iliacs, and then I'm going to listen for her femorals. Listening for any breweries. Okay. So next we would do some light palpation. Next we would percuss. I'm going to percuss your quadrants, and in the stomach you should hear tympani, and I do. So her liver, for a liver span, you would go mid-axillary line under the umbilicus, and you would percuss up until you heard dullness. You would mark it and then go back to her mid-clavicular line and percuss down until you heard dullness. You would mark those spots. That would be her liver span. You would measure it, and it should be 6 to 12 centimeters. So for her to percuss her spleen, you would go mid-axillary line and then the last intercostal space, and you should hear tympani. So then, after percussion, we would do some light palpation. I'm just gonna palpate. Any pain?
No.
And do some deep palpation. feels soft and good. I would try to palpate her liver and her spleen, and then I would try her kidneys. We already tested for the costovertebral tenderness, and then I would just kind of touch her aorta just to see if I feel any pulsations or anything. Lift your head off and I'm just looking at her abdominal muscles and see that they contract when she does lift up. So that is the end of the head to toe assessment.